an honor and a pleasure to have one of the world leaders who helped a lot the Egyptian model on the international level, and also like tailoring what we already did as clinical breast examination model following the Global Breast Cancer Initiative. So let us welcome Dr. Mary Nyansky, the technical lead of the Global Breast Cancer Initiative from the headquarters of the WHO. She will talk about the Global Breast Cancer Initiative, its a global and regional perspective. Let us welcome Dr. Mary.
Thank you, Hisham. All protocols observed. It's really a pleasure today. Really honored, and thank you to all the organizers of the event for inviting me to speak. So my role this morning will be to take you through the Global Breast Cancer Initiative, and I will be giving you the global and regional perspectives. So I'll give you an overview in three aspects. The first one about breast cancer being a public health concern and why we have prioritized it at the WHO. I'll also take you through the GBCI pillars and what we are doing in accelerating implementation. And as I start this presentation, let me first of all congratulate Egypt. I sat back there listening to the amazing work they have done. So thank you so much for taking this work forward. We are really proud of the achievements you've been able to make, which will really be instrumental in shaping the agenda for the other countries in the region and beyond. So when we look at breast cancer, really it's the second most common cancer after lung cancer globally, but it is also the fourth most common cause of cancer deaths. But when you look at these countries in the world, they are actually covered in pink, which means in most countries, actually, when you look at 95% of the countries, breast cancer is either the first or second cause of cancer. So it's actually the leading type of cancer deaths in most countries. In 85% of countries globally, it is the leading type of cancer. So basically what we are saying is that interventions to address breast cancer will serve to really address most cancers, because cancers are addressed almost the same. So it's an index cancer that if we focus on, we will strengthen the health system, and in that way we'll be able to also manage other cancers. What is of concern for us is the survival difference for breast cancer between the high income and the low income countries. We see survival rates of 90% and above in the high income countries, as compared to 40% or less in the low and middle income countries. So this 60% disparity in survival is concerning. It's an issue of health inequities that we really need to seek to address together. We also see that we're having a number of maternal orphans, each year around 500,000, with half of these contributed by breast cancer. Breast cancer affects causes a lot of premature mortality, especially in the low and middle income countries, where it is estimated that 50% of those who die prematurely. When we look at countries that have achieved mammography screening, and this is actually what is ideal, because mammography screening is what has been documented to cause reduction, in mortality. Only about 11% of countries have achieved this, and all these countries are in high income setting. Increasing exposures to modifiable risk factors like being overweight, obesity, alcohol use, physical inactivity are contributing to the rising incidence of breast cancer globally. So I'll just give you a snapshot of what has worked in the countries that have achieved a reduction in breast cancer mortality so far. It is basically strengthening the health system and increasing coverage for essential health services, including achievement of universal health coverage. So this is what we have seen has been the characteristic of countries that have achieved a reduction in breast cancer mortality. So as we begin to discuss around how do we make services for breast cancer more accessible, we need to also define what would be the essential health package of services for breast cancer. What would be accessible to the majority in the public health facilities at no cost? So I think I will just go straight to the global framework. I'm happy to share with you that in 2023, we had a resolution at the World Health Assembly on the NCD expanded best buys, and breast cancer was actually one of the cancers that were adopted. So as we speak now, early detection, timely diagnosis, and comprehensive treatment of breast cancer has been included as one of the best buys for governments to prioritize in implementing national policies. So this is really a milestone for breast cancer. Going to the 3 pillars of the GBCI, we have the first pillar around health promotion for early detection. This is the pre-diagnostic interval. The second pillar is on timely diagnosis of breast cancer. And the third pillar is around comprehensive management of breast cancer. So just to give you, those who are not aware, the Global Breast Cancer Initiative was established in 2021, and its implementation framework in 2023. So now we are urging countries to adopt the GBCI implementation framework and implement it to reduce mortality. So these pillars are founded on scientific evidence that has been carried out. We had systematic reviews, lots of research that has been done to document that if we are able to do, to achieve the key performance indicators as evidence-based in the GBCI, we will actually achieve a reduction in mortality. Our goal is that each country targets to have at least 2.5% reduction in mortality from breast cancer every year. So the KPI 1 is that more than 60% of invasive cancers are diagnosed at stage 1 and 2. Again, I want to congratulate Egypt because I heard when I was seated there that you are now at about 50%. So it seems like you have achieved the first KPI of the GBCI. And for this, I think we need to really clap for Egypt and hope that we continue to reduce this so that we can have more and more cancers being diagnosed at stages where they can be treated. So we have in the early detection, screening versus early diagnosis. I'll just give you a snapshot of what is recommended by WHO, that early diagnosis is a prerequisite and not a replacement to screening programs. So any country that is starting breast cancer early detection should start first of all with an early diagnosis program so that we achieve downstaging before you assess your screening readiness and now shift towards a screening based program. So there are indications that you need to look for to assess your screening readiness. And WHO is here to support. You can see we have representation, good representation, including from the country office and regional office, so that we support you to assess your screening readiness before you introduce a mammography-based screening program. However, we advocate for early diagnosis programs because it has been documented that it achieves downstaging that is also important in terms of making sure that advanced stages are able to access treatment. So this is just to remind us that RCTs demonstrate a 20% reduction in mortality using mammography. And it's recommended in most cases for women from 50 to 69 years. So on the second KPI, this is around diagnostic evaluation, imaging, tissue sampling, and pathology completed within 60 days. Definitive diagnosis done within 60 days. So this is also very important for us in terms of making sure that we are able to get cancer diagnosis in good time to be able to have comprehensive treatment linkages. It is known that delays in diagnosis have contributed significantly to poor outcomes. And a key challenge we see in achieving KPI 2 is establishing pathology laboratories. I have listened and also heard that in Egypt so far, we have 19 active laboratories that are conducting pathology, and this is commendable. So we have a guide for establishing pathology laboratory in the context of cancer control, which is a useful resource for countries that are establishing timely diagnostic and also implementing the GBCI. Additional tools can be made available at request. Looking at the third pillar of the GBCI, which is about 80% undergoing multimodality treatment, which includes surgery, radiotherapy, and systemic therapy without abandonment. Again, it is not useful to start treatment when you know that you're not going to complete it. It's actually a waste. As we know, treatment for cancer is quite resource intensive. Delays in treatment of 8+ weeks results in survival loss of 3 to 5%, and time to initiate treatment and treatment completion significantly impacts on outcomes. So just again to emphasize the need to ensure that we have mastectomy, radiotherapy, and systemic therapy completed without abandonment as required, and the need to have guidelines for this. So we need to encourage access to standardized guideline-based management for breast cancer. Encourage our countries to update their guidelines to make sure that they're evidence-based and do not rely on the high-income countries because the guidelines for high-income countries are slightly different in terms of context to the ones that will apply to the low and middle-income setting. So encouragement for guideline concordant care and providing incentives in this regard is really important. So I will go quickly to the issue around patient navigation and maybe center around this quite a bit because this is the first technical product that the GBCI has recently published on breast cancer patient navigation for early detection, diagnosis, and treatment of breast cancer. So we are encouraging the adoption of patient navigation programs for breast cancer all the way from screening, early detection, timely diagnosis, and treatment. Why? Because it's been demonstrated that patient navigation is an intervention that can actually improve outcomes for breast cancer. So in terms of making sure that patients are able to trust the system, use the services, and benefit from supportive care, we recently launched a patient navigation brief for breast cancer screening, and we want to urge all countries to adopt it for use. So in terms of the roadmap for implementing the GBCI, we have, since 2021, embarked on a number of initiatives. Currently, we are at the phase of having regional dialogues like this to discuss how can we accelerate implementation of the GBCI. We are focused on country action and country demonstration pilots, investment cases to disseminate, prioritize, and actualize the GBCI. So we are keen to work with all countries in this regard and support them. So we are also providing leadership as a WHO, providing also norms and standards, and also are available for acceleration of country impact in terms of technical assistance and establishing breast cancer programs, especially those that also want to incorporate patient navigation. We are also keen on having targets well documented, having monitoring and evaluation frameworks established, and mobilization of resources for implementation by bringing all partners together at the country level. So I think as I summarize, I want to say that breast cancer is a global health concern, and there is need to address health equity and universal health coverage in the context of breast cancer. Breast cancer is an index malignancy for strengthening the national health systems for cancer control and achievement of universal health coverage. Achieving reduction in breast cancer mortality of at least 2.5% per year by 2040 in all countries is a goal for the Global Breast Cancer Initiative. Focus on value-based care, cost-effective strategies, and context-appropriate evidence-based management is what we are encouraging. And last but not least, building commitments, investments, and monitoring and evaluation frameworks is key to address the burden of breast cancer globally. Thank you so much for listening to me.